I'm Minnie Roh. The healthcare system in America is difficult to navigate, even when you're a native-born English-speaking citizen. Add into that language difficulties and other barriers to entry like legal status, it's no wonder that a huge number of immigrants, including the undocumented ones, are falling into the quagmire of the medically uninsured. But thanks to a network of clinics across the country offering free preventative health care, this population, which includes Asian immigrants, are getting the help they need.
What bedroom's the emergency?
Ambulance, 75-year-old male.
워낙에 건강해서 제가 이때까지 살아오면서 감기도 잘 안 알아요.
Hi, how are you?
Soon Hwang came to America as a missionary from South Korea 20 years ago. She doesn't have health insurance because, as an independent contractor, she says it's too expensive, and she had always been relatively healthy. What she didn't know is that she is suffering from a disease that doctors call the silent killer.
혈압이 너무 높은 걸 몰랐는데 우연히 쟀을 때 혈압이 너무 높아서 너무 높았는데 머리가 띵하고 좀 아팠어요.
Doctors would have caught her high blood pressure sooner, but Hwang never went for annual checkups because she didn't have medical coverage. Then she heard about a clinic in Bergen County, New Jersey that offered free medical care.
We have people who come in here who have not seen a doctor in 10 years. And they know they don't feel well, but they don't know why it is. And they come here and their hemoglobin A1C levels, which are what we look at for diabetes, are off the charts. So they're diabetic, like full-blown diabetic.
Amanda Misty is president and CEO of Bergen Volunteer Medical Initiative, a nonprofit organization in Hackensack, New Jersey that offers culturally competent, free primary preventative care for low-income county residents who are uninsured.
People who don't have insurance would either go to the emergency room and they will get billed for something that will just completely crater the family because the bills are so high.
It's an issue particularly prevalent in the immigrant population, where many are self-employed and are small business owners. They fall into a gray area. They make too much money to qualify for government assistance, but cannot afford private healthcare insurance. The Kaiser Family Foundation, a nonprofit focusing on national health, found that when people do not have medical insurance, half the time they won't seek routine preventative care, and even worse, will postpone or go without treatment for sicknesses due to the costs involved. While the Affordable Care Act, or Obamacare, implemented in 2014 resulted in a drop overall in the numbers of the medically uninsured, there is still a large swath of immigrants who remain vulnerable. The KFF found that only 10% of citizens are uninsured. But when it comes to immigrants, that percentage increases dramatically, especially for the undocumented.
The reality is that people who don't have insurance end up paying more money for the same thing that people who have health insurance pay for, because things have been negotiated by insurance companies and hospitals.
BVMI is staffed by fully licensed healthcare professionals who are, for the most part, semi-retired volunteers giving back to their community. BVMI is part of a larger network of clinics called Volunteers in Medicine, with 90 clinics in 29 states, all of which offer free quality health care within their communities. There are about 45 million immigrants in this country, with the majority of them living in California, Texas, and the New York region. Bergen County, New Jersey has the highest concentration of Korean American residents nationwide. In 2018, BVMI implemented a Korean patient program and hired a bilingual Korean coordinator and a nurse practitioner. BVMI hopes to set up a similar program for other Asian populations in the future.
A lot of our Korean patients haven't been able to go to the hospital for a very long time. So when they do come to BVMI, we discover various illnesses. Definitely when we see Korean patients improving in a span of a couple months, we know that their lives are being changed. So it is really exciting to be able to see such tangible change in front of me.
Our patients are very grateful for what they get here. They feel like they're seen here. People listen to them and they take really good care of them. So that's the kind of place that we want to have.
We will get to her back about mammogram.
As for Huang, she says she is grateful to have found BVMI before her health issues evolved into something that could have been catastrophic. BVMI is funded 100% from contributions from private donors, corporate sponsorships, and foundation partners. The cost for care per patient totals $1,000 a year. I'm Minnie Roh for Asian American Life.